हेल्थ इन्फो न्यूज के यूट्यूब चैनल को सब्सक्राइब कीजिए और हमारी हर आने वाली वीडियो के नोटिफिकेशन के लिए बेल आइकॉन प्रेस करना ना भूलें।
The WHO had declared the pandemic after seeing the world figures, and definitely the pandemic is still on. We all have to continue to remember that, okay, there are certain activities like people have started going to office or going to school and college because the economic activities cannot remain shut down for that long a period. But while we are taking vaccination, both the doses to give us protection against this particular virus, the COVID appropriate behavior will have to be practiced at least for another 6 months or till the proper guidelines are issued either by the WHO and ICMR in our country that yes, now we are safe and we can go back to a normal life. As of now, these protections are still very important for all of us. Again, very important. You see, as you know, there are many vaccines which require multiple doses. And for this particular COVID virus, we have seen that two doses are required of this vaccination. And the time or the duration is usually specified and told to the individual depending upon which vaccine he or she is taking. And to develop a good antibody titer to fight against the virus, it is definitely required that both these doses should be taken. Yes, the priority of the government says at least the first dose is taken and encourage people to take the second dose also. This will offer proper immunization and protection against this particular COVID virus. And in case they even develop an infection, it has been seen in most of the studies, it is less severe. The mortality and morbidity of catching a severe infection leading to these is lesser. So safety is definitely more. So each and every individual who has taken the first dose and is eligible for the second dose should take the second dose. What happens is that, normally before surgery or after surgery, it's better to keep a gap of around 2 weeks. That's because suppose somebody takes a vaccine and then there is a major surgery. Usually there is some bit of issue with the vaccine, very mild fever or body ache or headache, which might be there. So these are very mild symptoms, and they might sometimes, there are other symptoms related to the surgery. Similarly, after the surgery also, there might be issues of body ache or pain. Patients are on antibiotics, etc. So a gap of around 2 weeks. But if there is an emergency surgery, there is nothing to stop it also actually. Then it can be conducted.
हेल्थ इन्फो न्यूज के यूट्यूब चैनल को सब्सक्राइब कीजिए और हमारी हर आने वाली वीडियो के नोटिफिकेशन के लिए बेल आइकॉन प्रेस करना ना भूलें।